Started. The House Committee on Families, Children, and Seniors will now come to order. Mr. Clerk, would you call the roll?
Chair Young.
Present.
Representative Scofia.
Present.
Glanville.
Present.
Arbit.
Present.
Edwards.
Present.
McDonald.
Present.
Wozniak.
Here.
Fox. Yep. Johnson.
Here.
Thompson.
Present.
Madam Chair, you have 10 members present, a quorum.
Thank you. And now I need a motion to approve the minutes from our, what was that? September meeting, September 12th meeting. McDonald, Representative McDonald, so moves. Thank you. All right, so today we are going to hear testimony on my bill, House Bill 4841, known as Teresa's Law. It seeks to improve adult foster care and assisted living facilities. With that, the committee will now go at ease at the call of the chair.
The Committee on Families, Children, and Seniors will now come back to order. Chair Young, thank you for bringing this legislation forward. You have the floor.
Thank you, Madam Chair. And good morning, committee. I am humbled and honored to be here before you today to discuss House Bill 4841, also known as Teresa's Law, which I introduced back in June. I would first like to start with thanking Patricia Scrabis, right? I would just want to thank her for bringing this to me and for being a fierce advocate, not just in memory of her mom, but for so many others who are making decisions about where to place their loved ones. And so with that, I'm just greatly, greatly humbled and honored to be sitting here next to you. Patricia's 91-year-old mother, Teresa, she died in an AFC facility, an adult foster care facility, after just 1 month in stay. From that time to this, Patricia has researched how AFCs operate and exploring the ways for improvement. You will hear her testimony shortly. The bill seeks to revise standards and regulations for adult foster care facilities to make them better and provide peace of mind for family and other caregivers when having to make the difficult decision to move a loved one into one of these facilities. This is an extensive, comprehensive bit of legislation. It's a lot to unpack, and we know that. But we wanted to start there. We wanted to start with the moon, and then we end up with the sun, something bright that we can all agree with. When I look at this legislation, I sum it up into 3 parts. I think about well, I won't get into that, but AT&T, accountability, training, and transparency. These are the areas that we're focused on. At this time, I would also like to thank the stakeholders that I met with over the summer. We had great discussion and good open dialogue, which actually led to some changes that will be made. We are looking at removing the stipulation for the licensed nurses and removing the stipulation around the social worker. This comes from having discussions. And so I'm so grateful that folks came to me and said, let's talk about this. Because this wasn't just something that we said it has to happen 100%. Though of course, when you do this stuff, you're thinking, well, if we can get by with 100%, we'll take it. But it's a negotiation, and so we're glad to say that we're still willing to work with all the stakeholders. This is what the process should actually look like and work like. And I look forward to continuing the conversation and moving this legislation forward. And so with that, I'd like to thank you. And at this point, I'm going to turn it over to my partner, Patricia Scrabis.
Thank you, Rep. Young. Thank you, Madam Chair and committee members, for your time today and for giving me the honor of speaking in front of you in support of Teresa's Law in memory of my mom, Teresa Salas Scrabis. I am here to talk about a serious and overlooked problem the abuse and neglect of seniors living in adult foster care, and a system that is failing to protect them. I have had the unfortunate experience of learning these facts the hard way after my mother suffered abuse, neglect, and indignity in a facility 2 years ago with no accountability. My mother's time in the facility she resided was short, only 1 month before she died, but it was long enough to recognize serious problems. What we were promised and what the facility cited on their website were in stark contrast to reality. The staff's behaviors were inappropriate, negligent, and abusive. For example, while I was there for a visit, staff members told stories and joked in front of my mom about all the residents that had died on their shift and referred to themselves as the angel of death. They also were unskilled in proper medication administration, for which I could cite numerous examples, but the most serious being the mismanagement of my mother's insulin. While I was there, staff came in to give my mom her evening Novolog shot, which had been prescribed to be given with meals. After they gave her the shot, I asked the staff member when they would be bringing my mom her dinner. And they said, "Oh, we don't eat dinner for another hour here yet." And I explained to the staff that she could not have her shot that early before eating, as the insulin is fast acting. The staff member apologized and said she didn't know, but would make sure it was given with meals going forward. I visually saw my mother's glucose levels begin to drop, and I quickly had her eat the treats I had brought for her birthday in order to get her levels back up. We would later learn that they had indeed continued to give my mom her shot between 45 minutes and an hour before meals on multiple occasions. Most egregiously, however, they bullied and intimidated my mom after she had a serious fall out of bed, causing injury to her ribs. My mom's fall occurred on a Friday evening. The next day, she was in so much pain they had started her on morphine. At lunchtime, she had asked to eat in her room due to the level of pain she was in, but the staff refused her. They said, "We eat lunch and dinner in the dining room here," and told my mom if she wanted to eat, she would have to go to the main dining room. I don't know if you've ever bruised your ribs before, but I have, and it was extremely painful at my age. It is unimaginable to me how painful this must have been for my mother at 91. Despite this, however, they forced my mom to be transported, which was no easy task, as she was already struggling to walk on her own prior to the fall. Staff had to manually pull her and lift her out of her recliner, get her in a wheelchair in order to transport her. I spoke to my mom later that evening by phone, and she was in so much distress and so angry that they had bullied her. When I told her I was going to call the staff to talk to them and have them help her get ready for bed, she said, "Don't you dare call them." She said, "I don't want them in here. I don't want them touching me." I said, "Mom, what are you going to do if you have to go to the bathroom?" And she said, "I'll go in my pants if I have to." She said, "And I'll sleep in my chair tonight." My mom was fighting to hold on to what little dignity she had left, even in her vulnerable and weakened state. My mom rapidly declined and died 1 week to the day of the willful act of cruelty. There were other issues that occurred that I simply cannot talk about because they were too painful, and I am still trying to maintain some of my mother's dignity. We wrote numerous letters to the facility, but didn't receive a response from them, not one word. We also filed a complaint with Lara. The investigation resulted in 2 violations of failure to provide safety and protection of a resident and failure to treat a resident with dignity and respect. We were told that they could not cite the facility for mismanaging our mother's insulin because adult foster care facilities are not held to the same standards as homes for the aged and nursing homes. This didn't make any sense to us, as the same medications have the same adverse effects if not administered correctly, regardless of where somebody lives. After this, we began researching other cited violations, and we found that we were not alone. Ours was not an isolated incident. I'm going to show you a few slides now. We pulled complaint data from Lara for 3 years, and this is for large group homes. And as you can see, alleged and substantiated violations continue to rise year over year. there was a 76% increase in substantiated violations from year 1 to year 3. This next slide shows a snapshot of all group homes, small, medium, and large. And these are just the cases that we know about. Experts say that abuse is often undetected and underreported. The National Center on Elder Abuse estimates only 1 in 24 experiences of abuse is reported, and that 1 in 6 seniors likely suffer some form of abuse, and that number is considerably higher for seniors with cognitive issues, 1 in 2. And I'll give you an example. The reason they say it's more common for seniors with cognitive issues is that they are less likely to be believed. An example of that, at the facility where my mom resided, a family member submitted a complaint that staff got in their mother's face, who had dementia, slapped her hands, and called her a bitch. The facility and the staff member both denied it. And then the family produced a video from a camera that they had in their mother's room. And sure enough, the abuse happened just as they reported it. This is a case in which, were it not for the camera, the abuse either would not have been reported or their mother likely would not have been believed. This is a busy slide, but it's a lot of information. We have gone through literally hundreds of investigation reports and read some pretty horrific stories. And it raised awareness or highlighted the fact that staff are unskilled to meet the increasing needs of residents in adult foster care facilities. We also saw a pattern of repeated offenses, suggesting that corrective action plans are not an effective deterrent to prevent recurrences. I provided numerous examples, but I'll talk to just one. There was a facility in Kalamazoo that had been cited for 2 violations of non-working fire alarms and failed evacuation procedures. Each time they were required to submit a corrective action plan. After that, they had a false fire alarm go off in the middle of the night, and while evacuating staff, a resident was dropped and dragged. She had scrapes and bruises on her feet and legs, and when interviewed, staff said her leg didn't look too twisted. She was taken to the hospital in extreme distress and died 3 days later. The investigation resulted in the facility submitting another corrective action plan. As we began to research AFC's More in Michigan, we realized that we had a moral obligation to do something. Even though it was too late for our mom, we couldn't bury our heads in the sand and ignore what was happening, and that has become the impetus for Teresa's Law. It is a proactive solution that focuses on 3 components that Rep. Young has already mentioned: accountability, staff education and qualifications, and transparency and disclosure requirements to inform families to make powerful decisions. The 3 components will address the systemic issues that are resulting in poor quality of care and are driving direct care workers to leave the profession. At this time, I'd like to show you a few photos of my mom and tell you a little bit about her. This is my mom on her wedding day, and my dad's day too, I guess. It's always about the bride. This is my mom with one of her many beloved grandchildren. And this is my mom 2 weeks before her passing. My mom was funny. She was a compassionate and loving mother, grandmother, and friend. She lived out her values of hard work, integrity, and love of family. She raised 7 children with my dad on a small farm while holding down a full-time job outside the house. And she was the first to care for ailing family members, often doing the undesirable. She always put others before herself. And she was a fabulous cook. She lived up to her Italian heritage in the kitchen. Large Sunday spaghetti dinners and holiday feasts were the norm for our family, and my mom made it all happen without ever letting on how much work it really was. She was so selfless, and she deserved to live out the end of her life with dignity and respect, as do all our seniors. In closing, this issue impacts all of us, as we are all aging or have loved ones who are aged. and we will all come to the point in our life where we need help with our personal needs that are often very sensitive in nature. And what happened to my mom and others could happen to you and me. The systemic issues impacting seniors will only worsen as baby boomers continue to age and Michiganders find themselves seeking care outside the home and family if nothing is done. I urge you to support and prioritize Teresa's Law and leave a legacy that protects our most vulnerable and gives them a dignified life. Thank you.
Thank you. And so with this legislation, that's what we're doing. We're looking to update PA 218 to make certain that our loved ones are being cared for, to standardize some things. Unfortunately, if there's no law, then there's no way to track if things are being done appropriately. And so that's why we've decided to put these things, to present legislation before this committee and hopefully to bring it to the floor for a vote, because we believe it matters. Folks who know me know that I have a saying, love is the work. And so because we care about people, because we care about how folks are being cared for, particularly during the last years of their lives, they should be lived with dignity. And knowing, when I look at this room and I look at my colleagues and knowing how busy all of us are, if we have parents, we have grandparents that may need help in one of these facilities, I would like for us all to have the peace of mind of knowing that they're someplace safe and that they're being cared for the way they deserve to be cared for. Additionally, I just wanted to be said that at no point were we thinking that this legislation would put anybody out of business, right? We understand that there are smaller homes and we're taking all of those things into consideration, but I believe in that definition of insanity, where you keep doing the same thing over and over again and continuing to get the same result. And we cannot do that. Lives are at stake. And so that's why we are bringing this legislation before this humble committee. With that, thank you, Madam Chair.
Thank you, Representative Young, and thank you, Ms. Grabus, for your testimony. So, colleagues, are there questions for either Rep. Young or Ms. Grabus on the legislation? Who was first? We'll go to Representative Glanville and then Rep. Thompson.
Thank you, Madam Chair. Thank you. And I'm sorry, I can't quite see you over there.
Move that
Thank you so
chair
much
out
for
the
your
way.
testimony and for your work here. It's really shocking to hear a story like this, about a family member, and to imagine it could happen to any of us. So again, thank you for your courage in coming forward and for your perseverance in following up on this issue. One question I have, and you didn't say this, but I was kind of reading along in your testimony. You mentioned that the facility was being advertised as an assisted living facility rather than adult foster care. So I don't know, Rep. Young, or who can answer this, but I'm just curious, and we know we kind of touched on this last week too, but just understanding the differences between the types of facilities and what should be expected. And things and that sort of thing. I'm assuming that's included in the bill. I saw there were
Those definitions.
yeah, well, and I saw too that there was the requirement to the facility information piece. So I guess that speaks to that, but that's what I want to clarify once again, because I know you're pulling out some of the nursing requirements and things. So I just want to understand how a person goes from adult foster care to assisted living, or how that determination is made.
Well, I'll start.
Yeah.
We talked about it last week.
Yeah,
Those were
yeah.
questions
That's
that
what
we
I wanna-
asked. Right,
yeah.
right. We asked Laura those questions last week. And it's based on where the person is staying and that staff there being equipped enough to know where the resident should be, right? Because some parents, some family members, and this is just true talk, some family members are dealing with financial constraints, and they know that they need help, and they'll try to fit a loved one who may need more help into a AFC. but we're counting on the facilities to do the right thing. And unfortunately, what we're finding sometimes, some don't. Did you want to add to that?
Yes, that, I think what Rep. Young talked to you about, we always felt that there needed to be some integrity during the assessment process. First off, we didn't know the facility that we put our mom in was an adult foster care facility, because they identified and market themselves as assisted living, as do homes for the aged. So we had no idea there were 2 levels of assisted living that offer basically the same services. But my understanding is, as I learned later, that there may be some stricter requirements and regulations around homes for the aged. Had the facility said they were an adult foster care facility, it would have raised some questions for us. What is that? What is an adult foster care facility, and what does that mean? But we were very honest and upfront with the facility during the assessment process of our mom's needs, and they assured us that they could take care of her. So I think that's why the transparency requirements are so important, is that families don't know. They're not likely to ask, or even to know to ask, what type of facility is when they're identifying and marketing as assisted living.
Thank you. And just as a point of order, will there be more testimony today, or is this it?
Yes.
Oh, okay. That's what I wasn't sure what else we might be hearing about, because I have other questions, but I'm not sure they're appropriate for this testimony.
Thank you. Representative Thompson.
Thank you, Madam Chair. So first, I would like to address you. I am so sorry about what happened to your mother. I have worked in several nursing homes and hospitals as a nurse. I have seen many caretakers and nurses and CNAs and direct care workers that give lovingly and give everything they have and work above and beyond for patients. And then I've seen some that don't. And it's really sad that we have so many bad apples in going into healthcare. So I would really like to address that. But my question is for Rep. Young. When you said that you introduced this bill in June, and then you said you met over the summer with some stakeholders, can you tell me the names of some of those stakeholders that you met with? Because this was in drafting the legislation.
Yeah. I met with, Hope Network. I met with some folks that will be giving testimony on today. Let me see. I know. Yes, the Michigan Assisted Living Association. We talked to some folks, and I heard their concerns. And that's what caused us to look at the legislation prior to, I even had a meeting during the Mackinac Policy Conference discussing this legislation. Because the way things are able to get better is you need to have multiple voices. You don't want to be siloed. You want to be able to hear from different people and to find out where you can meet in the middle.
And I also heard, I'm actually reading the recommendations from the MALA right now, and I really like what I'm reading here, especially the importance of develop and maintaining a thorough, accurate assessment plan for residents. Making sure that the assessment plan addresses their concerns and implements a plan, hopefully with checks and balances. I noticed that you're going to be possibly removing the nursing aspect, the medication aspect. And then I guess my next question would be that you are aware that I'm a nurse, right?
Yeah.
Well, when we talk about working together in work groups, and if this legislation was introduced in June and it's still not ready to go, and it's being brought to us for testimony, maybe next time if you reached out, we could have had a really good conversation and maybe not brought us all to this point where we're actually not able to move forward with this.
Well,
So
I can
working
appreciate-
together would be wonderful.
And we have worked together before, Representative, and you're right, you are a nurse. And I'll tell you this, when you're working on legislation like this, and you talk to a number of different people, and then when you have a partner that's as passionate, who has done the extensive research like she's done, I have a saying, sometimes you have to bring the legislation out from the shadows, because we'll find ourselves stuck in a cycle of work group after work group and meeting after meeting. I've had folks who believe that this would never get a hearing because we would never be ready, but I didn't think that that was the way to go. I felt that we needed to go ahead and get this legislation out the shadows so that we can continue to hear if there's anything else. And so you have had an opportunity now to look at this. We can have further discussions afterward. I'm not calling for a vote today or next week, but it will be a time where we're going to call for a vote because this legislation needs to move forward. There is an opportunity to improve the way we're doing business with our adult foster care facilities, and that's what we're going to do. Thank you, though.
Thank you, Representative Thompson. And now we will go to Minority Vice Chair Wozniak for his question.
Thank you, Madam Chair. For the testifier, is there, there's a requirement in here that the department must provide online services to the residents, educating them on resources. Are you stating right now that the department notification to residents is deficient?
Yeah, we can do better. That's it. It's not that it's non-existent, but that we can do better. Go ahead.
Most of the transparency requirements, we're requiring that when a resident, prior to admission, that the facilities provide information to them as far as the complaint procedures, internal and external, the ombudsman information. We knew none of this. After our mom passed and we tried to file a complaint, I mean, we had to really search and dig around to figure out how do we do it. We had no idea. We just started Googling and making calls. None of that information was provided to us. So I think some of that transparency has to come from the facilities.
You weren't provided a patient's bill of rights for a signature?
I was not my mom's primary caregiver, but when I went through all her admission papers, I didn't see anything in there.
Okay. And with regard to that, as far as there's some comments about improving the training for the people that are there, were the people in that facility also deficient in their training? Or?
Well, we didn't go through to see what all training, that's one of the questions we learned after the fact that I wish we would have known to ask, what training do you provide for your staff? And how often do you provide that training? It wasn't until after all this happened in the complaint process that when we looked at the requirements for LARA that the training is very, very minimal that is required for these facilities. And when we did our state-by-state research comparison, we found Michigan was really lacking. Some of these states had such really stringent training requirements at the lowest level of care that we would call them and say, this can't be right. It's an assisted living, same type of services. Why are they requiring so much training of the direct care workers? So we would call them, and it took us about 9 months to a year to complete our research. And so, yeah, we did not know that at the time that very little education was mandated by the state. And I'm sure some facilities may provide more than others. I don't know. But we obviously did not have a positive experience.
And you were in a licensed facility, right?
Yes, it was licensed.
Okay. Have you made a differentiation between unlicensed and licensed facilities?
I don't know of any unlicensed facilities. If they exist, I'm not aware of them.
Right. Supposedly there's a number out there of how many there are, but nobody
You're still trying to get that answer.
so nobody knows
We
it
didn't give it
yet.
to you last week, and we're not going to give you one this week. There you go.
And
I think one more question, that's it.
all right, one more, but we do have some other members waiting. So
Yeah,
go ahead.
no problem. With regard to the workers, this has always concerned me. We're putting people in vital situations, but we're paying them the least of anybody. Can you see any improvement to that in this system, or requiring a wage increase because they're learning more?
Well, we did look at a study Impart Alliance did, and they partnered with a company called PHI that did a study and a survey of direct care workers. And they found the two reasons that they were leaving the profession was low pay and lack of training and education to feel equipped to do their jobs. Mm-hmm. So as far as the finances, I'll defer to Rep. Young on that.
Yeah. We're always looking to support our workforce, and that's a conversation that we continue to have. It's not a new conversation. We know that our healthcare workers have been underpaid, and so we continue to look at ways to support them. Yes, sir.
Yeah, and I look forward to your support in the future on that, too.
So, Representative Wozniak, thank you for your questions. We are going to move it along. We have 4 additional members with questions, and so we'll have a follow-up question from Rep. Glanville, and I will ask members to keep it brief because we have several more folks who are going to give testimony. Thank you.
Yes.
Rep. Glanville.
Thank you. I just wanted to say thank you to Rep. Young. I appreciate the process. I appreciate having something come before us where we can have this discussion. We can hear from the various stakeholders and amongst ourselves, what our questions are and help you craft this legislation. I'm wondering, and I want to thank you too for working with me because I have reached out to you and gotten some really positive response on things as I've been working with stakeholders on this as well in my community. So thank you for your partnership there. Two kind of things I'll just throw out there. One, I'm wondering if this bill might be broken down so it becomes a package of bills. I don't know. I feel like maybe we're trying to solve too many problems in one bill, and that's what's catching us up. Like there is as you said, there's 3 parts to it, so maybe it makes sense to make it a package of bills. That would be easier to kind of handle each issue independently.
I appreciate that because that is something that I've talked about.
Okay.
And we're looking at that. That's not off the table.
All right. And then the second thing I was wondering, because Patricia, I find myself in your shoes these days in that I am the sandwich generation and I am beginning to navigate my parents' care and I have no idea what I'm doing. But but I am aware that there are caseworkers through hospitals and different resources. So I'm curious kind of how that came about. And maybe you don't need to answer, but just as a question, like I'm wondering what the role of the caseworker is from the medical side, if somebody has a medical power of attorney, or who's making these decisions that the person needs to be in adult foster care and then helping navigate that system, if there are navigators, or what that actually looks like for folks who are supporting that older generation.
From our personal experience, my mother lived in the independent facility of this particular business. And so we were in constant communication with them at what point it would be required to move my mom into assisted living. So, but we have a member in our Facebook group. I think there's just a lot of confusion, even amongst some of the groups that help families in choosing a facility, because her mother is in a home for the aged, and she's working with one of these for-profit agencies to help find a home. And they're suggesting, because she wasn't happy with the level of care and the standard of care her mom's receiving, they're suggesting moving her into an adult foster care facility with the assumption or the understanding that she might get better care because they're smaller. And at the time when she reached out to me, I said, it's my understanding, after the fact, that the level of care and the requirements are stricter in home for the aged. I said, I'm not certain of that. So I think there's a lot of confusion, even amongst the groups and agencies that are trying to help place these families. That's why I think disclosure. Facilities have to be able to disclose that information to prospective families.
Thank you.
Thank you, Representative Johnson. Did you have a question? Yes. Well, we're really good up here.
You are good. You're like a mind reader. I'm not really in front of a mic, so pardon me. Thank you so much for introducing this. And I want to say that I appreciate the heart and the soul behind this, because many, many, many people have watched their loved ones die in hospitals, in nursing homes, and adult foster care. And we have a true cultural crisis with how we treat our older people or disabled or those who just can't do well for themselves. And in a global sense, we need to work towards a kinder, better culture overall. I would love for us to tighten this up a bit, this legislation, but I love the direction you're looking at. I think we got to look at across the board, tightening up just the basic enforcement, also hospital, nursing home, adult foster care, wherever we're taking care of people who can't take care of themselves. Certainly during the shutdown, we saw people dying alone that has to be addressed too, because solitary confinement is abuse in and of itself. And we haven't addressed that as a culture, as a state, as a group of humane people. I'm with you heart and soul. I watched my father die in the hospital with many, many, many mistakes. My uncle, and it could have been avoided. Their lives could have been lengthened. I totally understand and appreciate this, and I'd love to work together going forward with more detail and tightening up. Thank you.
Okay, so just a reminder, thank you, Representative. Reminder to stick to questions, and we'll go to Representative Edwards, please.
Thank you. You know I'm always brief. So I just want to thank you for having some transparency and bringing this issue to us. I know sharing your mom's story had to be really powerful and probably carried a lot of weight with you. And Rep. Young, I appreciate you for tackling this. But my question, you may not even be able to answer it, but I'm just wondering how much longer before we have this policy or this bill in place so that we can vote on it, or what else is needed? Because I know we're always taking the tone on saving lives, and this right here will save lives. So I'm wondering how much longer is it going to be before we start saving lives?
Right, so to that, Representative Glanville just made a point about perhaps us breaking it down, breaking it into additional pieces, but that doesn't take long. We've done that before with legislation. That's not hard to do. And so my goal is to have this before all of us, by the beginning of October. We'll be ready to vote on this. So those who want to continue to work with us, let's get together, let's do that. But we have the meat right here. The research has been done. I can guarantee you the research has been done. My partner here, oh my goodness, they've gone through every state and have found how they handle their adult foster care and assisted living facilities and homes for the aged. And so that is such a great benefit to have that wealth of knowledge at the table with you. But that means we're already ahead of the game. And so Representative Edwards, you want to join in on these conversations, let's go ahead. We'll look at what it looks like to potentially have, I'll talk to our policy folks, we'll talk to LSB about the potentially 3 bills to address 3 different areas or whatever that looks like. But that's why we have these hearings, because that's when you, again, bring the legislation out of the shadows, and then we're able to talk to folks. So thank you for that. It's coming real soon, Representative.
Thank you. And last question from Representative McDonald.
Okay, if you could have a little patience with me, a little bit of a statement, but I'll get through this quickly. I also want to say I'm so sorry for your loss, and especially the situation that led up to that. My mom had Alzheimer's for 10 years, and that was a very long journey. And at the time, I thought I was very smart about what was going on, and I studied. I went to the LARA website. I learned everything I could, and found out when I started investigating this legislation how little I knew, and that I didn't know at one time she was in a home for the aged. I had never heard of that term before. There was a lot of bad information out there. Sometimes there's information that gets pushed that's inaccurate by some for-profit 800 numbers that, when you're desperate for information, you try every avenue you can. Okay, I'll try to make a question. But I just want to say that I think what's really important is that every family needs as much accurate information as we can get as early as possible in this process. I am just curious, what is the status of this AFC? Are they still open?
Yes, they are. Yes, they are.
Dare I ask what their name is, and would you tell me if I did?
We're not going to do that.
Okay.
But,
What location?
I mean,
or even where it's located?
They have locations all over, in several different states as well.
yeah, they're big. They're one of the big ones.
We have so many complaints and repeated violations from multiple. It's not just exclusive to this particular facility that my mom was at. I mean, it's prevalent.
Yeah. Okay.
The committee will now go at ease.
The Committee on Families, Children, and Seniors will now come back to order. With that, we have a few folks that want to provide testimony on today. And so, first up to provide testimony, we will hear from Rick Farron. Is Rich? Okay, there he is. Rich Farron from the Healthcare Association of Michigan, known as HCAM. You will introduce. With these two as well. Okay, right, with these two, along with Jonathan Zima, right? Yep. And Jennifer Post. All right. You guys, all right, there they are. So go ahead and do a further introduction of who you all represent one more time. Thank you so much for joining us today.
Will do. Thank you so much, Chair Young, for the opportunity to testify. We'll try to keep it brief. My name is Richie Fromm with the Healthcare Association of Michigan. We represent about 360 nursing facilities across the state and 260 assisted living communities across the state. Our assisted living membership includes homes for the aged, adult foster care facilities, and independent living communities. Joined today by my colleague, Jenny Post. She's our VP of Assisted Living Services, and our immediate past chair of our AL board, John Zima with Doherty Health. HCAM is opposed to the bill as introduced because we viewed it as fundamentally changing the role of AFCs in the long-term care continuum, but very grateful and happy to hear from the chair today, willingness to continue conversations, and thank you for the previous conversations and hearing us out on those. So I'll quickly pass it over now to Jenny and to John to share the AFC's role in the long-term care continuum and some of our concerns with the bill. So go ahead, Jenny.
Like Richie said, my name is Jenny Post. I'm the VP of Assisted Living Services. I want to thank Chair Young and committee for hearing our testimony today. Adult foster cares are based on a social model rather than a medical model, and they serve a population that does not require 24/7 nursing care. The way that the legislation is currently proposed, it conflicts with the statute that does not allow continuous nursing care in the adult foster care settings. The example of the provisions are the requirements for staffing, like Rep. Young had stated before, in regards to nurses, social workers, and certified nursing assistants. Now, last week, Laura spoke briefly about the intent of adult foster cares to be like a home-like environment. I'd like to expand on that in regards to the payment for the adult foster care, as well as passing medications in an AFC. The majority of AFCs that take care of the aged are private pay. Medicaid does have a program, however, through home and community-based services that allows a waiver, paying an AFC for care for the eligible resident, similarly to paying for a caregiver to come into a resident's home. Passing medications in an AFC community is similar to a resident taking their own medication in their home. If a medication is needed that can be only administered by a nurse, for example, IV antibiotics, then a third party would come into play, such as a home care company. This would be the same as if a resident lived at home and needed IV antibiotics and a home care company to come in to administer. House Bill 4841 also proposes a completely new set of training requirements for employees of adult foster care communities, and we would be willing to continue conversations about training requirements and look forward to working with the bill sponsor and other stakeholders in regards to that. This legislation also imposes fines for noncompliance found during licensing inspections, and we believe that that is very excessive. The current process that Laura utilizes and enforces is effective and ensures protections are in place for residents. Like Laura presented last week, explaining that their current process and the fact that 34 revocations were issued last year. While we share in the goal of enhancing resident safety, the unintended consequences of adult foster care closures and access issues are very concerning. To share additional perspective on how this bill actually would affect day-to-day operations, I welcome John Zima to share his story.
Thank you, Chair Young, for hearing me out today. As Jenny said, I'm here to talk a little bit more about the day-to-day operations of AFC Homes. Currently, we hold 6 AFC licenses in Michigan. Our first campus opened up in 1999, where the owners that opened that campus, the very first resident was their dad. Their grandpa. And after that, their dad, about 20 years later, who opened the company, ended up moving into the facility. And I currently have a mom living in a senior or long-term care facility as well. So how do people find out about AFCs? You've heard from a lot of online resources, other things, but when they come to us with a need. So we usually get a call from a family member that says, hey, I have resident so-and-so, they're not safe at home anymore, can you help me out? What do you do? And so that begins the discovery process for us, which is the next step for us. So when somebody comes to us, we ask them to come in, to sit down and learn about either that person looking for themselves or them looking for a loved one. When we figure out that discovery process of could we meet their needs, like what do you need help with of the activities of daily living, because we're not a medical model, so we're not here to treat, diagnose, and all that. So we're looking at those activities of daily living, of the bathing, the showering, the toileting, the dressing, and that type of stuff. So we try to go through that discovery process and figure out, are they a good fit for the community and can we meet their needs? After that, we reach out to the physician for their healthcare appraisal. So once we reach out to the physician, they'll fill out a healthcare appraisal, which gives us kind of their history and the current medications they're on. Now, this can vary a little bit depending on if they're coming from home, if they're coming from the hospital, if they're coming from a skilled nursing, but a physician always has to fill out the healthcare appraisal. So if somebody's coming from the hospital or a skilled nursing facility, you might get a little bit more of a history of what just happened, what caused them to end up in the hospital, what caused them to end up in the skilled nursing facility. Whereas when they're coming from home, sometimes you don't get the whole story or the whole history that you're looking for. With that process of the physician appraisal and are they a good fit for the community, we create their service plan when they move into the community. So that is our steps on how to care for that resident. So does that resident need standby assist? Do they need one-on-one care? Do they need a transfer? That type of stuff. Do we need to, or do they have a wheelchair? Do they have a walker? Are they independent and all that stuff? So we try to walk them through that steps. And the service plan is something that's created with the person moving in, signing off on it, or their representative, guardian, whoever it may be. After the service plan is created and the family signs off on that, we move to the move-in. And the resident comes into the community, they bring their medications with them. We have to follow the medication list given to us during that healthcare appraisal process. And we have to follow those orders exact to pass those meds. We cannot deter from that. We cannot allow over the counters. We have to follow what's exactly on that list and when to give it and how to give it. And along with that move-in, you do a skin assessment of the resident. You take their vitals, temperature, so you have a good baseline of where that resident is when they're admitted to your community. So moving forward, you can monitor that of, if the resident's losing weight and you're doing monthly vitals and things like that, to kind of look through that process. If somebody has a fall, goes out to the hospital, that's when we look at reassessing those residents for changes of condition. If it is a fall, if they do go to the hospital, if they become sick, we send them out and have the physician look at them. If they do come back with changes of condition, that's where the service plan comes into play again. We have to redo that service plan to make sure that we can meet their needs and sit down with the family and say, maybe we can't do 2-person transfers here anymore, or maybe, whatever the need is, that's when we discuss that, and is other placement needed for their safety because we can't meet their needs. I think that's about it for the day-to-day operations. Richie, I know you had something else.
Yeah, no, I appreciate the opportunity because, as several committee members have stated in the previous testimony stated, it is confusing. I'll admit I can get confused about what all the settings are sometimes. So I appreciate Jenny and John, the opportunity for them to come in and help describe. I thought it might be helpful to describe what those AFCs are doing on a daily basis and how we try to address some of those issues. I think community consumer education is an area where it's pretty low-hanging fruit that we could all agree on. Let's make sure everybody is understanding what these different settings are able to serve, and make sure that people are being placed appropriately. So we're very supportive of that. So that's our brief testimony today. We're happy to answer any questions the committee may have.
Oh, okay. Thank you so much. So I did have a question, because it's one thing to know what you're supposed to do, and it's another thing to do it, right? That's why we're here. If folks just did what they were required to do under law, we probably wouldn't have this. And so we're looking at increasing the incentive. So I'd like to go back to your point around not wanting to have any type of fines imposed. I know that the quickest way to get somebody attention is to hit their pocketbook. That's just real talk. That's just what we do. And then when we look at the situation with Patricia's mom and how that facility has gotten corrective action plans, I mean, we're back on that cycle again. And so if that's not really yielding a change behavior, then what would your recommendation be?
That's a great question. So, I mean, the actions from the previous testimony are reprehensible. And of course, we should all work together to ensure that that stuff does not happen in any of these settings. Again, a lot of really good comments from everybody about the value of this generation, of our aging adults. And, you know, we just came, actually, we're in the middle of our annual convention in Grand Rapids. We drove in this morning for this, and it's rejuvenating every year to meet with our members who are so dedicated. They just, I mean, it takes a special kind of person to come into long-term care and care for this population. I think when you're talking about specifically of fines, all of those fines are resources that are being directed away from bedside care, and experience of other states. It's our understanding that those fines can actually be it can actually be a net negative for the department in trying to enforce those fines and going through those appeals process. So it's not necessarily the end-all be-all for preventing care. I think if we talk about how we can improve the situation, touched on it already, just consumer education and making sure, and even the transparency. I think this does intersect with transparency, making sure those settings are communicating effectively and accurately to the incoming residents and their families what services will be provided. And then if you ask John, if you ask our AFC members, if you ask our skilled nursing members what the number one issue right now is, it's going to be workforce. So what's the number one way to ensure that terrible things like what we just shared don't happen, to make sure that we do have the best staff possible, is to try to attract the best people we can to the profession. Unfortunately, the profession is down. Each CAM estimates 10,000 caregivers, employees, since the start of the pandemic. A lot of other healthcare sectors have rebounded. Unfortunately, long-term care continues to struggle. There's a lot of talk about what the pay is. We do a wage survey. They've gone up 20% since the start of the pandemic. You know, when you're talking about the skilled nursing side, that's predominantly Medicaid and Medicare. So it's hard to increase those without those rates going up. Even when you look at the assisted living side, it is more private pay, but you don't want to price anybody out of the services that they need. So, I mean, it is a profession of caring for people. So providers are doing everything they can to attract and retain. I would like to thank the committee again, the continuation of the direct care worker wage increase that was included in the past budget. That's been there for 3+ years now, expanded to non-clinical staff within nursing facilities, also interacts only a little bit with assisted living through the My Choice waiver. So it puts that assisted living a little bit at a disadvantage there. So while it's so helpful on the skilled nursing side, you could see how that can prove challenging for the assisted living side. So every time we're kind of pushing a button here, it's having an impact over there, but really appreciate the question. I hope I answered it somewhat.
You went all around the world. No, but that, I mean, because the way I look at it is, you get hit with one fine, you don't keep making them, which would cause the problems that you said. So that's just my opinion. Representative Arbit.
Thank you, Madam Chair. Our chair is blocking our view over here. You mentioned at the end of your testimony about the need for consumer education, which I think throughout our hearing today, as well as last week, that was very, very evident to, I think, everyone across this committee room here. And I was wondering if you have any ideas, recommendations. I mean, a couple of us have bandied about, should we do some PSAs? Like, what do you think possibly could work? And I understand that this is a little tangential, but I think really important that we're missing right now, because even I, new to this before this conversation, I had known about these facilities and didn't necessarily have a word for them or a term for them, and now I know that they are adult foster care facilities. But I would guess that many Michiganders are not aware of the distinctions between the different modalities of care that are on offer for people. So,
another great question. I think a PSA, we'd be all about that. I think we'd be supportive of that. I think if we could somehow get just like onto a one-pager and make that available on Laura's website, MDHHS's website, I know we'd be willing to share it as well, just to describe this. I mean, the questions are enlightening about how a lot of these terms get conflated, we'll hear just, for example, those storms that came through last month. There was an assisted living community in Williamston, Michigan, that I think the roof got blown off. I think it was actually one of our members, and thankfully nobody was hurt, but in the news it was nursing facility gets hit by the storm. It was actually, do you know what it was, Jenny? AFC or HFA. So they get conflated in common conversation and through the media. I think a one-pager, just assisted living is...
Yep, we got it.
Yeah. Okay,
Right.
I'll stop. Yeah.
I'm sorry, yeah.
No.
Thank you, because
No,
we
I-
have
I'll be-
several to
of course,
testify.
yeah. No,
We've got
I
a
don't
couple
need
of
to
more
babble
questions for you all, but I got to get to some other folks. Okay, so we good? Thank you so much, Representative Arbit. Representative Wozniak?
Thank you, Madam Chair. For John, you discussed a service plan. Is that service plan considered a doctor's order?
It is not considered a doctor's order, no.
Just a recommendation?
Yes.
Thank you.
Thank you. Representative Glanville?
A question, I think, is it Jenny? Yes. Yeah. You mentioned something about making facilities as safe as possible for patients or for clients. I'm wondering, because I've been working on looking into another issue here. Are AEDs required in adult foster care and assisted living facilities?
They are not.
I wonder if we might consider including that in this in some capacity, or at least have that conversation. Can we add that to the conversation?
I'm absolutely
Not
open
that I want
to
to add
that.
more, but
Okay. Thank you all. Thank you for your testimony. I'm sorry. We got to move on to our next presenter. Hold your question, representatives. Next up, we will hear via Zoom. Is the Zoom ready to go? Justine Bykowski, retired gerontologist from the University of Michigan. Justine, there she is.
The opportunity to be with you.
Yes, thank you for your patience.
Long-term care setting for those with multiple chronic conditions and cognitive issues. Most residents require a combination of medication management, personal care, and mobility assistance. Families or elders seeking assisted living are earnest in doing the best to make complex and emotional decisions. They may receive general information from the Area Agency on Aging or the Alzheimer's Association. Typically, they have no substantive guidance and are not prepared for the complexity or the nuances of care policies and practices, and are not savvy about LARA's reports of abuse, neglect, and other violations, or how an ombudsman may help. An ombudsman can troubleshoot and can act upon violations, but typically they have large caseloads, and if abuse or neglect occur, their response may not match the urgency. To protect elders in assisted living, more proactive standards have to be in place. For example, when examining LARA's special investigation reports, you learn about a range of problems with medication management, such as running out, pharmacy errors, robbery, wrong resident receiving a medication or dosage, lost medications, and staff not trained adequately. I'd like to share two experiences with you. When working with the Michigan Attorney General's Consumer Protection Division in 2018 and 2019, the leadership became convinced that those seeking and in residential care settings had legitimate consumer issues regarding deceptive practices, safety, right to information, right to be heard, and the right to seek redressal. Awareness of these unknown factors became a part of the AG's educational programs. Post-pandemic, they have not continued. Secondly, collaborating with a geriatric social worker, we examined the most serious and repetitive violations in another type of assisted living care. We surveyed homes for the aged between 2017 and 2020 across Michigan. A report is available. Our findings overlap with the most serious and repetitive problems that occur in AFC homes. Medication management, safety protection, and staff training shortages were all at the top. Using our findings and experience, we developed an educational program to discuss the parameters of assisted living, where to find HFA regulations and violations and redressal options. People who come to our programs tell stories about abuse, neglect, unskilled caregivers. They don't know where to turn or what their rights are. Also, they have concerns about filing a complaint because they fear retaliation, or ask, what's the payoff for rocking the boat? Moving their loved one is not the answer. There's no guarantees that the next place is going to be any better. Reaching the public through educational programs is good, but it's not the answer to systemic and sustained change. Educational programs are hit or miss. Laura has
Okay, we're gonna need you to wrap it up. We're running out of time. I'm sorry, we have session at 1:30, so you got like 1 minute.
have the authority to impose financial penalties and require transparency about violations for seekers at the time of inquiry. These actions will have more of an impact in giving care homes more incentives to reduce violations that cause harm and injury and are repetitive.
We appreciate you so much for joining us today. Do we have one question? One. Okay, I know. All right, thank you so much for your testimony. Next, we will hear from Robert Stein, General Counsel of the Michigan Assisted Living Association. Thank you all for being here. We're now at turbo speed. Sorry about that. Feel free to begin when you're ready.
Madam Chair, members of the committee, I'm Robert Stein, General Counsel with Michigan Assisted Living Association, and I'm joined by Brenda Roberts, who is the association's Director of Quality Assurance and Education. Our nonprofit organization represents a broad range of community-based providers, supporting over 30,000 individuals with disabilities and older adults, many of whom receive services in adult foster care homes. And we've been representing adult foster care providers since the enactment of the initial AFC licensing law in 1973. And we appreciate this committee's focus on enhancing the adult foster care program and the efforts of the committee chair in introducing House Bill 4841. We also appreciate the preliminary comments this morning with regard to the bill and some of the concerns that we've raised. And while the association opposes House Bill 4841 as currently proposed, we welcome the opportunity to have discussion on enhancing the adult foster care program through statutory changes as well as potentially administrative rule changes or policy changes. And several of the key areas have been mentioned with respect to disclosure requirements, staff training, accountability, and transparency. And again, we've included in our 2-page written position statement several recommendations which Brenda will provide an overview of, and they're all intended, we think, to enhance and improve the adult foster care program, and they would be statutory changes which could be incorporated into House Bill 4841. Some of them are in House Bill 4841, and we think further modifications could be made. Brenda?
Thank you, Bob. And thank you, Representative Young and committee members. I'm simply going to highlight a few of the things that we've outlined in our testimony for the sake of time and not go through it point by point. However, I do want to say that I've been with Michigan Assisted Living for 20 out of the 50 years in my experience in a long-term care industry. Prior to coming to this association, I served as the long-term care ombudsman. And I'm proud to say I was a direct care worker early in my career at an adult foster care home, and I've served as an administrator of an AFC home. And like some of you who shared today about family members who are living with dementia, my husband's been living with dementia for approximately 9 years, and we have toured and have selected an adult foster care home that we will be moving him into at some point in time, likely. So I just wanted to give you that little bit of information about myself. And Patricia, thank you for sharing your experience. You are right to say that every person deserves to be treated with dignity and respect. And I'm proud that Michigan Assisted Living Association is committed to the highest standards and and quality of life for persons living in adult foster care homes. I want to reiterate, adult foster care homes are a social model, not a medical model. We are banned, quite frankly, by law to have persons who require continuous nursing services. As mentioned earlier, it is a home-like setting. Happy to hear that the proposed social worker and licensed practical nurse is being reconsidered, because those things would fundamentally change the long-term care system that we have had in place for 50 years. And although we cannot provide continuous nursing, as the folks from HCAM said, there are nursing services available for those people who live in an adult foster care home, just like those services that would be available for me in my own home through home health agencies, the My Choice Waiver Program, as well as through the behavioral health system. And so what are we proposing, as you will note on the second page of our testimony, is that we're proposing that we convene a work group and discuss and enhance some of the very things that Patricia has mentioned earlier in terms of the process of assessment and care planning. Let's take a look at the staff training and especially the disclosure requirements, and that's all outlined in this paper. Bob and I will be happy to answer any of your questions. In fact, I might even volunteer him that he might be able to answer that assisted living question.
Yeah, I would just like to quickly respond to Representative Glanville's question, which was an excellent question, because we receive that inquiry all the time. What is assisted living? And just to reconfirm, although we talked about it, I don't think we necessarily discussed the continuum of care with great precision. Adult foster care homes are licensed from 3 to 20 and can support people 18 years of age or older. So some of the individuals residing there are older adults. There are a substantial number of persons with developmental disabilities that live in homes specialized for that purpose, mental illness, traumatic brain injury. It's a wide spectrum in the adult foster care home. And it's licensed for 3 to 20. Now, the only exception to that is that if a home provides support for 4 or less persons through the community mental health system, monitored by the community mental health system and that recipient rights system, then a license is not required. But for the most part, we're talking about homes licensed from 3 to 20 for individuals with disabilities or older adults. Homes for the aged are licensed for 21 or more. For individuals 55 years of age or older, so that they're not designed for younger individuals with disabilities. Age waivers can be granted in limited instances. And then finally, assisted living is not a statutorily defined term in Michigan. And that's, I think, part of what causes the confusion.
That's exactly what helps
And we agree with HCAM's recommendation to the question that was raised about consumer education from Representative Arbit, that it would make sense to have an easy to read through explanation of the entire continuum of care. Nursing homes, homes for the aged, adult foster care, and more independent living settings. That we agree with that approach.
Thank you for that. We're gonna work with the department on that.
Yeah.
Because it's just necessary. Everybody's good? Okay, we have one, McDonald, okay, one quick question, Representative.
Quick question. Okay, I'll try. Thank you, Chair. And maybe this is a crazy question, but I'm just kind of wondering, my sister is a direct care worker in adult foster care, but it is strictly developmentally disabled. I'm kind of wondering if back when this idea back in the 70s was originated, is that really what it is for? And that there is this creep of older and sicker people who are using AFCs that aren't appropriate, and there's got to be a way we can slow that down. I'm just guessing that might be the problem, that it's not really the older population that they were designed for, because they take so many meds. It's not a matter of passing meds when somebody has dementia, because they don't know what they're supposed to be taking. So I'm just wondering if it was really created for younger populations.
Well, it's an excellent question. And the adult foster care program since 1973 has consisted of homes specializing for people with disabilities as well as other homes for older adults. But I think you've hit the heart of the issue, and that is we need to make certain in the assessment planning process, as well as throughout the time that the person lives in that adult foster care home, that it is the appropriate setting and that everyone's clear on what the procedures are. And I think there can be statutory changes to bolster that issue when it's not the right setting for that person. I think that is the heart of the issue.
All right, well, thank you so much for your testimony.
Thank you
for the question. So we have probably about 7 minutes. 7, I know. I hate being the 12 o'clock committee because we really can't spill over much. 7 minutes, so let's see if our last presenter is able to go ahead. If not, I'm looking for Dr. Christina Marsak-Topolowski and Professor Anne-Marie Kelly via Zoom. So, there's one. Is it both of them? I thought you guys were testifying together? Right, okay. Oh,
You have our slides in front of you, or as part of the legislative hearing testimony that go into more detail on these points, but we're here today to echo a sense of urgency around these bills. People are dying. People are suffering in preventable ways. And we want to point out that Michigan already has protected statute for vulnerable adults. Adults in AFCs fall under the legal classification of vulnerable adulthood. But right now, the way our law stands, the idea of vulnerable adulthood is just an idea as it applies to AFCs. Our current laws just do not back up that this is the most, this is the population that is the most susceptible to abuse, exploitation, and neglect. And our laws just don't reflect that there's a gap there. So we need this, what this bill does is confirms that our definitions of abuse need to be modernized. Right now, as they stand, they focus only on physical abuse and harassment. I don't think there's a person in this room who would deny us adding the bill's language of emotional harm, of mental harm. And some may feel a temptation to disregard some of the horrible cases like the one Patricia described today. You might be tempted to consider sentiments like, sometimes unfortunate things happen to good people, or adult foster care expenses are challenging. But I want to point out that this committee knows that abuse is abuse. And if any entity has concerns with following up and following through about abuse reports in an AFC, this bill sends a simple and clear message that abuse in all of its forms is never acceptable. And so merely hoping that entities will do the right thing, it's not enough to protect our vulnerable adults. And these are real concerns that there are ongoing abuses that are being unchecked, unreported, and repeated because of the nature of the vulnerable adults. Really quickly, my colleague, one of the leading experts on caregiving in the nation, can talk about exactly what vulnerable adulthood is and why it applies to this group and why we're not doing enough to recognize that vulnerable adulthood. Dr. Marciak.
Hi, thanks for your time. I'll be as brief as possible. I think this rhetoric is very, very important. I've worked for over 20 years with individuals with developmental disabilities, and I'm also a gerontologist, and I do caregiving research, focusing on a number of different things, as well as research for people with IDD, intellectual and developmental disabilities across the lifespan, as well as older adults with chronic conditions. We recognize that this is really a multifaceted aspect, but we know that people in our AFC homes are those with intellectual and developmental disabilities. They are vulnerable. There are also people that acquire disabilities across the lifespan. Somebody had mentioned people with traumatic brain injury or TBI, people with other things that might acquire in terms of health and mobility implications across the lifespan. And if we get to the heart and the soul of this, we know that this population is deeply in the situations that's very precarious in terms of finding themselves in positions where things are underreported. Both consumers as well as their families are oftentimes afraid to report things, and they often might not know the mechanism for which to do so. That should bring each of us great concern. If it doesn't, we need to pause there, right? And I think we're probably all on the same page with that. But I think we have not only a societal expectation to improve these things and to modernize these bills, but we have a moral obligation, right? These are our families, these are our friends, these are our neighbors. This will be us. If we live long enough, we will be in a position of requiring care. For those of you familiar with former First Lady Rosalynn Carter, she has a beautiful quote that basically gets to the heart and soul that each of us will be a caregiver or need care, or be both at some point in our life. And I think we really need to push the needle. Yes, there are provisions in place, and yes, those are not modernized. Those do not meet the needs to any extent for these people, for people with disabilities that are lifelong, for people that have acquired conditions who are maybe older adults. And we know that people are vulnerable for a number of different ways when we start to look at activities of daily living, instrumental activities of daily living. And I think we're all somewhat clear on the premise and the intent, and certainly the impetus over the last 50 years of why AFC homes began. And these are not for medical reasons. However, people there have medical needs. And so we need to figure out how do we push the needle, modernize, and make it comfortable so that this can be sustainable for those who are providing.
And on that note, I know, I was waiting on you to take a breath. We appreciate both of your testimony. I apologize that we have to move because we have to get to session. And so with that, thank you all members. I need to read in our cards. We have Tom Hickson, Michigan Catholic Conference, not wishing to speak, but in support of the bill. We have Sally Pung, Michigan Long-Term Care Ombudsman, not wishing to speak, but in support of the bill. We have Dana Lazenby, CEO, Oakland Community Health Network, not wishing to speak, opposes the bill. Lynn Alexander, Presbyterian Villages of Michigan, not wishing to speak, opposes the bill. Dalton Herbal, I think, Leading Age Michigan, not wishing to speak, opposes the bill. And Alan Bolter, CMH Association of Michigan, not wishing to speak, opposes the bill. There we have it. Another successful Family, Children's, and Seniors Committee. Thank you all. We are adjourned.